With regard to, Dr. Rowe talked about the medical scribes. Elaborate on that pilot program, because I know in the private sector, these are great private sector solutions, and I know that the doctor will have more time with the, I mean, it's been proven in the private sector that the doctor will have more time with the patient. I had a town meeting that lasted 4 hours a couple weeks ago. People were bringing that up. You know, you want the doctor to focus on medicine. Elaborate on that program, that pilot program.
Well, I've heard a lot of this. I've been to 195 different VA facilities, and every one I go to, there's a different approach. But we're pretty consistent in the operation of a PAC team, which is a patient care team, a team of people working with a particular patient. On those teams today, we don't yet have a scribe. So I think what Jim was describing was, let's pilot the scribe so that everybody on that team can be working on the patient and not just entering information into the medical record.
Yeah, I didn't come prepared today to really expect this question, so I will have to take it for the record and get you information about where we are in terms of standing up a pilot program.
Okay, thank you. Any other innovative medical solutions coming from the private sector that you've implemented in the last year? Do you have an advisory council set up of physicians possibly that work in the private sector to get these ideas to make it more efficient and productive?
In fact, we have two, believe it or not, we have about 20, we have more than 25 advisory councils, but we have two that I'd like to tell you about. One is our Special Medical Advisory Council, which is the best medical minds, I think, some of the best medical minds in the country. It's chaired by, the chairman is John Perlin. John is the chairman of the American Hospital Association. He's also the chief medical officer of HCA. He's also a former undersecretary of health, and they're providing tremendous leadership. On the My VA work that we're doing with Transform VA, we've also set up an external advisory council. We have many doctors that are part of that, including Toby Cosgrove, who's the head of the Cleveland Clinic, Rich Carmona, who was a former Surgeon General and also a veteran. But I have to tell you what, one of the things they're bringing is they're not only bringing their innovations and their ideas, but they're taking away our innovations. A couple of weeks ago, we published an article that was picked up in medical journals, not broadly in the newspaper, about a new Monte Carlo simulation technique we can use to predict suicide. This is a breakthrough. If we can validate this model of predicting suicide, this will be a breakthrough for the VA, but it will also be a breakthrough for the American public. And a lot of what we've seen, and you and I have talked about in the past, has been innovations that actually start in the VA, part of our $1.8 billion of research spending that you appropriate, and we appreciate it, that result in positive results for the American people. Here's a copy of the article, and Mr. Chairman, if you'd be willing, I'd be happy to put it in the record about this breakthrough. And we have more of these breakthroughs coming.
Very good. Sir, we need to get the word out on this choice program. A lot of people don't know. I know you sent out a card. What else have you done to get the word out? And then I have another question with regard to access.
So we've mailed letters to everybody. We've mailed now, I think, 3 letters totally to everybody, first with their card and then follow up. We have another flyer that we've just developed. We have a website that we have just re-engineered. So we've been doing surveys of veterans who use the choice program, asking them what they think about the program. And one of the biggest issues they've had is with the website and the availability of information. So we now have a redesigned website that's about to go live. It has a live chat on it so that the veteran, while they're looking, if they can't find the information, they can click the chat button and talk to somebody right then and there. So we've really done a lot. We had a set of outbound phone calls to people initially who were actually waiting for care more than 30 days to contact them about the choice program. So we've tried to do a lot of outreach.
Sir, my constituents are having trouble getting access to the program. Describe, for the benefit of the constituents, our veterans, our heroes, describe the scenario how would it work? They would call the VA for an appointment. Could you describe a real-life scenario?
Yeah, so there's two benefits under the Choice Program. One is if you're waiting more than 30 days. If you're waiting more than 30 days for an appointment, our staff, if you either call in or while you're, checking out of clinic and getting a follow-up appointment, our staff will tell you if you cannot get an appointment within 30 days, that the Choice Program is available to you. They have information that they can hand out to the veteran about the Choice Program. At the moment, we are both booking an appointment for the veteran in the VA and offering them a Choice Program and making that referral to the third-party administrator. The veteran can decide which of those two options they want at any time. We're about to change that program so that what will happen is at the time the veteran asks for an appointment, if we cannot give them an appointment within 30 days, we will ask them if they want an appointment in the VA beyond 30 days or if they would like to go to the community, and then our staff will contact the TPA and get an appointment for the patient. We need to do a contract modification to be able to put that program in place, but it's coming down the pike, and that should improve, I think, the coordination and the level of service. If you're in the 40-mile group, what happens today is that the TPA, our Tri-West and Health Net, already have your information, and you can contact them directly. You don't need to go through the VA to get an authorization for care.
Sir, we've got to make it easier for the veteran. That's what I've been hearing.
We totally agree.
Yeah, okay. Thank you very much. I yield back.